Good day, I'm Dave Sarrett, Dean of the VCU School of Dentistry. Today is March 10th, 2017, and this is the second Dean's Update. So I learned a month or so ago about a program at the VCU Health System known as Teledentistry, and actually the new program I learned about was Virtual Patient Visit Program, similar to a program at Cleveland Clinics called Cleveland Clinics Express Care Online, and our health system is planning to implement such a program so that physicians and patients can meet by virtual patient visits, and we're going to take a look at that to see how that might impact our abilities to reach out to our patients. So we'll put a link here for the Cleveland Clinic program you can take a look at to get an idea of what I'm talking about. Our pediatric dentistry department has really has been working with, based on a HRSA grant on developing a teledentistry program with the clinic in Orange, Virginia, Piedmont Regional Dental Clinic, that we collaborate with on rotations for our students as well as pediatric care. And this program will enhance the speed at which patients can be evaluated by pediatric dentists and receive specialty services. We're moving along with the programming and planning for new dental clinics that will be part of the VCU Health System's Adult Ambulatory Care Center, which will be built across the street from the Wood Building. That project moves forward with planners and architects. And at the same time, besides just thinking about building a new building, our vice president has really charged the deans here at the Health Sciences Center to consider looking at how we might enhance collaborative patient care within such a facility. So I'm working with the other deans and other leaders at the health system, and we're looking at how to build value into patient care and collaborative methods of taking care of patients have shown to improve patient outcomes and patient satisfaction. So we've developed a PowerPoint presentation, and we're starting to move that around the campus to determine how we might implement some of these new methods as we move forward with the design of this building. Our human resources department at VCU has been undergoing a year-long project now known as the Great Place Initiative HR Redesign, and the Great Place Initiative is actually an initiative to make VCU a great place to work and improve the employee satisfaction. And this is really part of updating our human resources program, which is really for staff at the university really been based on a civil service a system that's been in place for over 100 years. So looking at making moves so that we're competitive in the marketplace, as well as linking career development and performance management and rewards. So more of a business-like approach. I attended the senior leadership meeting hosted by President Rao. This is a meeting he conducts about twice a year, brings together leadership across the health system as well as the university, some 100 people, deans, directors, vice presidents, those sorts of folks. And we look at various topics. The topic of this meeting last week had to do with working in this time of change and flux. There was a slide that talked about we're in constant white water, and that's an environment we'll have to learn to function in. And we had a great program put on by Bob Kelly. Bob Kelly is a former UCROPS executive and now a faculty member in the School of Business, and he did a really great program on understanding change and moving organizations forward, and a lot of the psychology involved with that. And actually I'm going to try to see if I can get Bob to come and speak to our faculty at one of our faculty retreats. Great news here. I'm really proud to announce this. Dr. Steve Forte, a VCU biology grad, a VCU DDS grad, a VCU endodontics grad back in the 1990s, great endodontist and servant to the dental profession. He's receiving the Spirit of Service Award from the American Association of Endodontics. And so I can't be more prouder than Steve. And this past week I got to participate in a little video that will be played at his awards ceremony at the AAE meeting next month, and really proud of Steve. Another great piece of news is Dr. David Burns, a professor in our Department of Prosthodontics, has been elected president of the American Academy of Prosthodontics. So congratulations to Dr. Burns, and another great accomplishment by our VCU faculty. I like to look through journals periodically and see what's going on. In my last update, I talked about that a little bit. This happens to be the Journal of Dental Education. Let me get it turned around there so you can see it. And lots of articles about things going on in dental education. I found a study here about the relationship between dental students' assessment ability and preclinical and academic performance in operative dentistry. And there's a study where they looked at the ability of students to self-assess and how that correlated with their eventual performance in operative. And I'll read one quote here from the abstract. High-performing students had more accurate self-assessments and tended to underestimate themselves. So I think all of us have to think about sometimes we really need to be a little harder on ourselves and not think that we really have everything all figured out. And as you read more into this article, you find that students that lack the ability to be more rigorous with their self-assessment are also the students that typically don't perform as well. And I guess there's some logic to that. And so I found that quite interesting, and hopefully we can apply some of those principles. At the university, the Wilder School of Government Public Affairs has appointed a new dean, Dr. John Accadino, and he's been serving as the interim dean. He was also previously the director of the VCU Center for Urban and Regional Analysis. Looks a lot at the impact of particularly the university and the health system on the region, and studies urban planning, of course. And Dr. Accadino, and I think it's going to be a great addition to our group of deans. We have a program that involves our collaboration with the Wilder School, and that's called the iCubed program in Child and Adolescent Oral Health, and it's a university program collaboratively that we competed for. We'll put the link to it for you to take a look at, but we're working with multiple schools and departments across the university to look at how to improve the oral health of the children in the city of Richmond and improve their access to dental care. And this week I attended a lecture that was actually presented by dental students who are involved in a faculty mentorship program to help them look at careers in academic dentistry. And they were mentees of Dr. Omar Abubaker, who's been working with our Board of Dentistry on developing prescribing guidelines for opioids. Actually, he and Dr. Ellen Byrne have been working on that project collaboratively with the Board of Dentistry. I don't think anybody hasn't heard about the concern about the opioid addiction crisis and people dying every day from overdoses of opioids. And the first contact with opioids often happens in the medical profession as well as dental, of course. And it appears that those of us in the healthcare professions have probably been too loose with prescribing too many opioid prescriptions. And so these are guidelines that are probably drastically necessary, or not probably, they are drastically necessary. And our students presented on a number of topics related to this and studies that they had investigated on prescribing habits and addiction in patients. And this was also part of their mentorship program, because each of the students in this faculty mentorship program had to conduct a teaching practicum, and they were presenting their lecture as part of that. Luke Corey, a D3, Connor Sherwood, Vikas Agarwal, and Ted James, D4 students, all presented. And one of the things I'll take away from this, and I think I'll share with you, is let's think about using more ibuprofen, Advil, and Tylenol versus opioids. And 400 milligrams of ibuprofen and 100 milligrams of acetaminophen can be just as effective as an opioid. Another webinar I watched this week was from the ADA Health Policy Institute. Very good office at the American Dental Association that studies access to care and health utilization dental services, and they're really digging into this in a big way, and they're now studying the percentage of people dentists who are affiliated with a dental services organization, and those are corporate entities that assist dentists or either hire dentists to practice, and their results show that now 7.4% of all U.S. dentists are affiliated with a DSO. They're also drilling down, and we're able to see how we're doing in Virginia. In Virginia, about 9% of dentists are affiliated with a DSO, and we even know about our own graduates in this study, and it appears that VCU graduates are now about 5.6% of them are affiliated with a dental service organization. And the last but not least, I'd like to congratulate the School of Dentistry volleyball team composed of students and faculty who won the 2017 Health Sciences volleyball tournament a week or so ago. So congratulations to all those folks, and also here we had no serious injuries, so I'm thankful for that. So we'll catch up with you next time, and look forward to meeting with you again. Good day.